Hello everyone, today is August the 5th. I'm Dr. Adam London, Director of the Kent County Health Department, here for this week's COVID-19 update. Here in Kent County, as of today, we have 6,645 diagnosed cases of COVID-19. That's about 50 cases per day as an average over the past week. So our rate of new cases is staying about flat with where we were at last week. And we're seeing a test positivity rate, which again is the percentage of our tests that are coming back positive at 2.9% for the past week. That's good. We're still staying below 3%, and we're staying much lower than most of the rest of the state, so that's very promising. We're at 5,204 recoveries as of today, and we're at 149 deaths. And that's a number that has stayed flat for the past week, so we're very thankful that we haven't seen a lot of new deaths in this past week. Some people are pointing to that low death rate as evidence that this is not a big deal. I actually look at it as evidence that what we're doing is working, and that by keeping our hospitals in good shape and by keeping transmission as low as possible, we're putting everyone in a good spot to recover from this, and we're preventing super hot spots in our county that we have seen in other places lead to excess suffering and death. So today I want to talk a little bit about stigma and some errors that I'm hearing in the community. In particular, I'm hearing about people who have recovered from COVID-19, fully recovered, are still being stigmatized by some. Some people are shunning them, thinking they're somehow marked with a germ, or they're somehow now infectious to be around. And the reality with these people who have fully recovered is you're probably less likely to pick up infection from them as you are the random person on the street. So let's be mindful about that, and let's do what we can to avoid stigmatizing people who have recovered from COVID-19. Other groups that we're hearing about with stigma are groups that have had higher severity rates or have been disproportionately affected by this pandemic. We're hearing about stigma toward people of Asian heritage, people who identify as Latino, and people who identify with African American as race. And while those populations in many cases have seen more severe symptoms, that's not because they're more susceptible to infection. It's because of other stressors in their environment, in many cases lack of access to health care, that has led to more severe symptoms. In reality, you're just as likely to pick this virus up from the average person, again, on the street, than you are a person from any particular racial or ethnic heritage. So let's be careful that we don't stigmatize people or think that some people are riskier than others to be around. The reality is, if you're going to look at the world like that, you're in a much better position to judge people based on their behaviors. I'm much more concerned about hanging out around people who go to parties and backyards, who don't wear masks, and who choose to be dismissive of this pandemic. The reality is that a person like that is much more likely to bring virus into the community than someone just by their racial or ethnic background. We're also hearing about stigma towards people who have traveled out of state. And there was a point in time where the CDC was recommending quarantine for those individuals. However, now, because there's community transmission of COVID-19 around the entire country, there really isn't any reason to have quarantine for people because of travel. So let's be careful not to stigmatize people based on that. Again, let's look at behaviors. And travel by itself is not necessarily a tremendous risk increaser. It does increase risk somewhat, but there are so many other factors that can increase risk as well. So let's make sure that we don't stigmatize people by their race, by their recovery status, by their ethnicity, or by their travel status. Something else I want to talk about are some errors that I'm hearing about what it means to be asymptomatic or mildly symptomatic. We've had a number of people who were positive for COVID-19, and maybe they were asymptomatic, or in some cases they just had a sore throat or a case of the sniffles, if you will. And we have told them that they need to be in isolation so they don't spread that virus to others. And they've been angry about that. And understandably, they're missing out on work. They're missing out on other plans they may have had, and thinking, I don't feel sick. It's just the sniffles. It's just a sore throat. This is being a hoax, or it's being overreactive. Well, I understand where they're coming from, but the reality is that one person's asymptomatic case or sore throat or runny nose can easily be spread to others and can manifest itself in much more severe symptoms, including death in other people. And we don't fully understand this. We know that people who are older or who are immunocompromised or have other underlying conditions are more susceptible, but we're also seeing that some younger people and healthy people, for whatever reason that we don't fully understand, also deteriorate into a very severe case of COVID-19. So we need to set that assumption aside that this is just a minor illness and it's no big deal. Be thankful. If you're one of the people who are asymptomatic or mildly symptomatic, that's something to be thankful for, because many other people are having a very different experience with this. And so the takeaway here is that we need to continue to stay positive, and that's important for those people who are inconvenienced by this in so many ways. We need to continue to stay heroic, and it is heroic to remain either in quarantine or isolation, to wear masks that are uncomfortable, to do the social distancing, to give up many of the parties and events that you may have been looking forward to. These are all heroic sacrifices, and I don't dismiss that lightly. These are things, however, that are having a positive impact in our community. They are keeping that case rate low, they're keeping our hospitals in good condition, and they're keeping that death rate low. So just encourage everyone, please stay positive, stay heroic, stay healthy, keep doing the things that are working so well for us here in West Michigan. Thank you, and I'll talk to you again next week.